Thank you, Shruti, and the entire panel for giving me such an opportunity.
Okay. And we welcome everyone who is available right now. Thank you for being here. Are you ready, Arya? Can we start?
Yeah. Okay, fine.
Okay, thank you.
Thank you, Shruti, once again, and the entire panel for giving me such an opportunity to be with you. And for engineering sessions, I am for the first time. So let me start. I have done a small presentation also so that it will be more clear for you. And as my husband is an engineer, he told me that don't make you bored with scientific explanations and all. So I have made it simpler. Okay. And for the last sessions, for 15 minutes, I have planned for an interactive session. So during that time, you can ask me anything related to this. Okay. Okay. And about myself, I'm Dr. Arya Ramesan, and I have been practicing since 9 years. And during my career, I have found that no one is much bothered about their health and their lifestyle because of their busy schedule. So don't forget that health is wealth. Okay, you have to keep on keep in mind about the importance of health. So I'm here with my sessions. Okay. Ayurveda is a science of staying healthy, not just a treatment thing. Okay. First, I'm going to deal with thyroid disorders. This is the most common lifestyle disorder ever seen in my clinical experience. Now, not only in women, but also in children as well as also among gents also. It's very prevalent. Among that, two type of thyroidism is there, hypothyroidism as well as low. Hyperthyroidism means sometimes the thyroid gland will be functioning much more time, otherwise it will be in a decreased state. Okay, hypothyroidism is much more prevalent in our clinical side. So what is thyroid gland? Thyroid gland is just a gland in front of your neck. It is very important for our metabolism. Metabolism means for our body building and all the functions in our body. Everything needs thyroid gland. Okay, moreover, thyroid hormones. There are three hormones from being secreted from this thyroid gland: T3, T4, and TSH. Okay, this is main. What is the reason for this thyroid hypothyroidism? It's not known yet. Maybe some studies shows that they think that it's mainly because of decreased iodine in the salt. That is the reason why we have been provided with iodized salt. But even if we are given this iodized salt itself, nowadays also, thyroid has been very prevalent. Not only that, the use of pesticides, organochlorides and organobromides, etc., will also increase the chances of thyroid, thyroid secretions. One study says that tapioca, its increased usage also leads to thyroid. Goitrogens means the increased functioning of thyroid gland leads to the increase in the structure of thyroid gland, so that in some ladies you can see that the thyroid gland will be in a very big thing. And some psychological patients who are mentally some ill, they will be having more of the lithium drugs, so that this also increases functioning of the thyroid gland. Deficiency of vitamin A as well as selenium also causes this thing, hypothyroidism. Most of them means the difference between your ATM card as well as cash. If you are having ATM card, no cash, what can you do? If you go to a shop, then where there is no swiping card. The same thing as with liver functions also. Most of the T3 is in the inactive form, T4 is in the active form. So if we, in order to get it converted into the active form, we need liver. So if liver functions are decreased, that means that there is a chance to have this thyroid. Okay. What are the symptoms of hypothyroidism? First, from the top to the bottom, you can go. Okay, hair. In the hair, you will feel that you can just go through that. It's mainly because of decreased calcium, because from thyroid gland, there is a some parathyroid gland is also inside that. Some cells are there, follicles are there. This produces calcium. So in case if it's not functioning in its proper way, it will cause calcium depletion also. That's the reason why doctors are prescribing you with calcium supplements also. And face also, you will be having some swelling below eyes and face, and neck also. There will be swelling, as I said earlier, the goiter. Swelling of this thyroid gland is known as goiter. And if you lie in a bed also, you will feel difficulty to breathe because of this gland being pressing the windpipe beneath our neck. Okay, and there will be difference in the voice also. You will feel something beat in your neck where you are in a lying position, and you will having palpitations. Means if you climb height, you will feel very much increased heartbeat and very much fast breathness. Food also, you won't feel any taste in your food, and your skin, you will be having very cold intolerance, and but sometimes you'll be having an elevated uh, body temperature also. Joints also, you will feel some pain, numbness, etc. And you will feel that your the dress that you have wore in the during morning hours gets tightened with evening. And this along about periods, you will be having an irregular or painful periods. Sometimes it can be increased also. Okay. The main thing about mood is that you will feel a depressed mood without any cause, without any reason itself. You will be feeling that you are very inactive and you will be very depressed out. But in case of hyperthyroidism, you will be feeling anxiety. It's the same, it's just almost the same thing in a different way, means as a opposite. All these are the symptoms. So while going through this, you may feel that everyone will be using, means experiencing these things. If you doubt in such cases, you have to go for a TFT test. TFT means thyroid functioning test. So that with that you can assess it with the TSH levels. TSH levels, if it's elevated, that means that you are having hypothyroidism, and if it's decreased, it means that you are having hyperthyroidism. Okay. Hypothyroidism and infertility. In this, I would like to say that hypothyroidism is a hormonal imbalance. So, during if you are planning to get conceived, make sure that thyroid functions are in the normal levels. During your puberty or adolescent time, during your menopause, during your pregnancy, beneath the above the normal level, the thyroid gland will get elevated, enlarged. Not only that, its function also will get enlarged. That is a normal thing. Okay, it's very essential for the baby during the first 3 months because it influences much of the brain development. That is why during most of the gynecologists they supply thyroid supplements during the first 3 sessions. So it's very important to go through your TSH levels before getting conceived. Okay. Treatment of this thyroid means in Ayurveda, it's meant to be 3 to 6 months Ayurvedic medication with strict dietetic regimens. Most of the patients come to me to get rid of this thyroid thing because they get fed up with this allopathic medicines. means modern medicine, because they have to use it for a long time. For lifelong, they have to use it because you are giving direct hormone. You are taking direct hormone inside your body. If you are taking that for lifelong, means in your house itself, if there is a maid to do all this household things, then will you do something in your house? No, never. We will be spending our life as happy. But if we give a chance to the body to work it by yourself, it, then it will be fine. Okay. So what is to be done is that when they comes to me, I says that they have to be in 3 to 6 months. They have to be patient, and they have to stick on to this diet also. So with dietetic regimens, I first and the foremost thing is that they have to avoid all junk foods. They should exercise regularly, and they should have bitter medicines also along with tablets, everything. And in modern medicine, the treatment includes only this pills. mm, and not only that, they have, in some cases there will be nodules, means some growth inside this thyroid gland. So in that cases, if the thyroid is enlarging, from front also as well as from inner side also, it will get grow towards our inside, so that we won't be able to diagnose it from outside. So for that thing, you need to get a scan of your USG, ultrasound scan of your neck, so that you may know whether it's growing up. So in that cases, if it grows more than 4 mm or 4 centimeter, then only thing that we can do is surgery, either partial thyroidectomy or complete thyroidectomy. That is the only procedure for that thing. Okay. Next thing is polycystic ovarian disease. Okay. Polycystic ovarian disease. Hope everyone might have gone through this. This is a healthy ovary. Okay. And this is a polycystic ovary. Polycystic, from the name itself, it's clear that many cysts inside ovary. Okay. Cysts are just fluid filled sacs. Okay. This in a normal human female reproductive system, it consists of an ovary, uterus, as well as vagina. From this ovary, it's completely filled with lots of follicles. Follicles means they are just a fluid filled with an ovum inside that, ovum or egg inside that. So during every month, due to the hormonal influence from the brain, this follicles get matured, and this follicles will release an ovum of, among these all follicles, only one of follicle will release an ovum, and this goes directly onto the uterus, and the rest of the everything will gets disordered. That is a normal procedure. Okay. But in case of polycystic ovarian disease, what happens is that these follicles won't get matured, and no ovum will be produced, and they will not get dissolved, so that they will stay as such. This is the reason for PCOD. Okay. And during this thing, what happens is that this release of this ovum, that takes place around 12 to 14th day of the period. That the period is, that time is known as ovulation day. Okay. That is the reason. So in order to release of this follicle, means ovum, the body needs little more support of the muscles, lower abdominal muscles. That is the reason why you are having mild lower abdominal pain also, cramps like pain, colicky pain like that during that time. That is the reason why you are having pain due. Okay. And only this much about that. And this ovary this ovum, when it reaches inside this uterus, it will be waiting for sperm to get fertilized. Unless if it's not getting fertilized, it will shut down with all the inner lining of the uterus along with it, so that this is known as menstruation. Okay, 28-day plus or minus 5 day is a normal thing. No need to be panic if it exceeds. Okay, some think that 20-day cycle is the perfect thing, but no need to be panic if it's plus or minus 5. It's okay with that. Okay, and moreover, most of the girls nowadays gets menarche at the age of 10. It's mainly because of their lifestyle as well as food pattern also. What are the causes of PCOD? Stress, hormonal imbalance. Stress, what does this stress means? It's mainly because when you are in, I mean, when this ovulation takes place, there will be a lot of hormones being produced. Among that, there is a hormone known as testosterone also. Okay, this testosterone, increased in testosterone, results in most of the male components to be in there, which includes most of the main and the most thing. The main thing in that thing is that you have to be, sorry, the main cause, the main thing is that stress. Sorry for a minute, my child came here. Okay, stress means more of this hormonal imbalance in our body, and due to steroid usages. Even if nowadays, even if you are having a cold or anything, most, especially in skin issues, most of them are using steroid usages and hormonal treatments also, in order to postpone your periods, or even if for birth control pills also. Everything contains hormones inside this. All these causes hormonal imbalance in your body. Your body is being balanced with a hormone balance is there. If you are getting something inside your, if you're putting something inside your body itself, it means that there is something disturbed inside. Okay, and sedentary lifestyle. Sedentary lifestyle means mostly you guys, as you are in IT professionals, you are mostly in sitting posture, so that your lower abdomen are not at all working, so that most of you might develop lower abdominal obesity. So that if our reproductive system is mainly in the lower pelvic region, okay, so that lack of this abdominal muscles, lack of this abdominal muscle strength, it will cause the more of fat deposition over there. Obesity is also a cause, and food also. Junk food, increased intake of food, of junk food also results in PCOS. One minute.
Yes, now it is visible.
Okay, fine. So PCOS symptoms, it is seen both in obese ladies as well as lean also. Okay, some might experience increased menstruation, some might experience less menstruation, some might have it as no menstruation at all. Okay, and there will be more hair growth in your face as well as in your central body part as in chest. Hmm? There will be more of pimples, there will be blackish discoloration of your neck, and most of you might develop masculine features, that is, hoarseness of their sound as well as breath, etc. Okay.
Um,
Okay. Next comes complications of PCOS, and I just forgot to say you, in PCOS, as it's a hormonal imbalance inside your body, most of them, most of the studies have said that there is an increased insulin production inside the body, but you might develop insulin resistance. Means insulin is being insulin is being produced in your body in order to decrease the sugar level. But in case if your body is not able to identify insulin, means you will be developing an insulin resistance. Means insulin is being produced in your body, but your body won't be able to recognize it as insulin. So that there will be much hike in your blood sugar level also. That is the reason why doctors are prescribing metformin type tablets. Metformin, most of you might know that metformin is meant to decrease, is mainly prescribed for diabetes patients. So this is the reason why you are given this thing. Okay, and the next complication is infertility. The main problem or main complication is infertility because no ovulation is taking place unless and until ovum gets released. There will be no chances of them getting conceived. So it causes infertility, heart disease, hypertension, etc. Treatments. First and the foremost thing that you have to know is that for PCOD, the first treatment is diet, then comes exercise, then only the role of medicines comes. So if you are having presently, if you are having PCOS, then first thing you have to go is for a dietic regimen, because unless you first you have to burn out every fat inside your body, provided you shouldn't give anything input as fat. Before having your food, just analyze it, whether it's fat rich or carbohydrate rich, everything. Just say complete no to junk food. Okay, and exercises means just walking doesn't mean exercise. You have to do stretching exercise for your lower abs, then only your muscles will be stimulated. Because for the menstruation to occur, the muscles that are supporting the uterus will go continuous and rigorous contraction and relaxation. Only because of that thing, the whole of the inner lining will shed it out. Okay, that is the reason. Because of decreased muscle power only, you are experiencing lower abdominal cramps during your first and second period stay. So if you are exercising in a very good manner, you will find out that during your periods you will be experiencing mild cramps. And next, in Ayurvedic treatment, we are having only we are having good treatment results for 3 to 6 months, but provided you have to continue medication for 3 to 6 months with strict dietic regimens. And in modern medicine, you will be having hormonal treatments for they are in modern medicine. What they do is that they will provide you with an hormonal treatment. That is, for 21 days you have to take a pill. After that, you have to stop it on for 21st day, and for 7 days you shouldn't take pill. So because of that, because of that hormonal withdrawal, you will have periods. Thereafter, you have to take it from the next after 20 days. Okay, so for 3 cycle you have to take it. That is the modern medicine treatment. Otherwise, they will be providing you with metformin for that insulin resistance. So one more complication of this PCOD is that there is a much more chances for you to develop type 2 diabetes also. Okay, and for surgery, if for this PCOD, we have to take it seriously, because if that fluid filled cyst, if you are not caring about that, it will get thickened. And if it get thickened, there is no other chance, no other option other than surgery. So that you need to go for either cystectomy, cyst should be removed, or otherwise you have to remove the ovaries as such. That is the only thing. Otherwise, in order to get conceived, you can go for any FNAC or IVF, etc. Next, we will deal with cervical spondylosis. You all are IT professionals, and I'm having a hospital also. In that hospital, most of them comes from IT field. Most of them are with posture imbalance. They all are in a wrong posture. They all are following a wrong posture. You need to follow a healthy posture, which is very, very important. Okay, you have to know that 90% of your life you are spending in your chair. So if that chair is of low quality, then you are of low quality. It will affect your health also. Just look at the first thing. First, human. Look at him. Look at his neck, the posture of his neck. It's correct posture of this vertebral column. And during that time also, around 5 kgs of weight is there, the weight of the head. If you're landing a bit more, that means that the weight is going on increasing. Okay, and it goes on increasing. Look at the pressure over the vertebral column, and this means 30 kg, almost 30 kg is there in the last picture. Okay, that is, most of them will be following that posture rather than the first thing. How many of you will hold your phone at your eye level? Most of them will be lying on their phone with their hands. Okay, so you have to correct your posture, which is very important. It is the first and the prior step to get out of this cervical spondylosis. What are the causes? As our neck is having this, our neck is being supported by 7 vertebrae, and in that vertebral column, this in between this vertebrae, there are many discs. Disc is just a cushion, so that it makes our neck very flexible, so that we can move our neck to any of this direction. So because of our wear and tear and degenerations, this joints of neck get degenerated, and moreover, the disc in between, placed between this vertebral column, they will get shrinked, as well as this it will become dry and dehydrated. That is the reason for most of the nerve root compression, so that the nerves getting out from this vertebral column towards our hands will get impinged in between with your more lean front, so that you will develop radiculopathy, means radiating pain, numbness, pain over your shoulder blade, etc. That is the reason why you are having this pain. Symptoms. What are the symptoms? You might feel most of them are presented with complaints of neck pain and stiffness. For night you will be okay, but when you wake up in the morning you will be having some pain over your neck or stiffness. The most main thing is that you will be using a very big thick pillow so that the neck position will be the same as in the means your neck will be in the forward leaning position. That is the reason why you are having stiffness in the morning hours. Okay, and not only that, how many of you do neck exercises? We are using only certain muscles that are bounded in the neck, so that you have to do some neck exercises. So the treatments include, in Ayurveda, it includes 14 to 21 days Ayurvedic treatment with complete bed rest. In our hospital, we do Ayurvedic treatment. Most of the cases are surgery suggested, but we get good result with our treatments, and the treatment includes both massage, cleaning, etc. Along with, sometimes we go for traction also, traction massage, etc. And thereafter, after 21 days rest, we will go for muscle strengthening exercise also. Only this can provide you a complete solution for your neck pain. Otherwise, it will be recurring, going on along with that, continuing throughout your life. So here are some neck exercises. Okay. This, hope you got it. Is that clear with you? First, you have to put your hand beneath your head and give pressure from hand towards forward, and with your head you have to give pressure towards back also, so that your neck will be, your head and your whole position will be in the same mode, but you will feel stretch along your neck side of your necks. Okay, and the same with front also, and towards lateral positions also you have to do the same thing. With hand you have to push against your head and head against your hand also. Okay, and these things also, first when you wake up or anything, for first 1 week you have to do exercises, just 5 sets will do, and gradually you have to keep on increasing, so that with 3 to 6 months, more muscles can be made powerful with 1 day or 2 day exercises. You have to keep on doing it for 3 to 6 months, provided it should gradually increase it, the sets of exercise, so that with 3 to 6 months regular exercise, you can improve the muscle power, so that you can get a good relief from this neck pain and spondylosis complaints. Ayurveda for hair care. In my clinic, most of them are concerned much about their hair. Mostly, more than girls, males are very much concerned about their hair. It can be damage or split hair or hair loss or gray hair, dandruff, anything. Dandruff, if I say about that, don't mix it with psoriasis also. Nowadays, psoriasis is very prevalent. Psoriasis, its initial symptom is this dandruff. You all should know that dandruff is a fungal infection. Even if you are having head wash most of the days, your scalp is not that clean. That is the reason why you are having recurrent dandruff attacks. If you are applying oil or if you are applying anything to your hair and you are going out, the dust particles get attracted, your sweat will be there, and our dead cells will be there. Everything will be there in a layer formation in our scalp. This gets fungal infected. Fungal infection will come over there. That is the reason why we are getting dandruff in a house. If one is affected with dandruff, means there is a chance that all others get affected with that, because it's very spreading. So you have to, what you have to do for that is keep your scalp clean. So before applying oil or before going to bath, take your head bath. First you have to do is that brush tightly, hardly brush your hair with the comb, so that all these layers will get free. Okay, after that you just wash it off. Don't use this cosmetics regularly. Every shampoo, either it's shampoo or conditioner or soap, everything is very rich in chemicals. These chemicals act hardly on your scalp, making it much more drier. All this adds on to dandruff. And about anti-dandruff shampoo, it is 4 times harder. It's very rich in chemicals. It will hamper your hair also. Okay, so this is the thing. Then about damage, most of the hair damage is due to low quality of your food intake. Hair needs calcium, iron, and vitamin E. If your daily food is not rich in all these things, it will precipitate in your body. Unless we provide good petrol on to our vehicles, no good um, we can't use our vehicle for such a long time, isn't it? That is the same thing with our body also. We should give on good quality food, then only we will get good outcomes from that. So hair needs vitamin A, calcium, iron. For that, my tip is you have to take in amla and every day in your empty stomach, 4 badam empty stomach. Have lots of sesame, 1 spoon every day. Then have 3 liters of water every day. Then you can have ragi, millets. Ragi is very rich in calcium as well as iron also. So include everything in your food so that your calcium and iron levels can be increased. Okay, healthy lifestyle. Now here we comes with healthy lifestyle. What is health? As per WHO, World Health Organization states that health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. If you are not having a disease, it doesn't mean that you are healthy enough. Okay, both physical, mental, and socially, you have to be perfect. Then only you will be said to be you are healthy. 3 pillars are being balanced with health: food, sleep, and exercise. Food is very important. It is a basic necessity of life. Before consuming a food, just assess it. Your quality of your health means it's the quality of the food that you're taking in. You should make sure that you are having a balanced diet every time so that it contains proteins, carbohydrates, fat, fiber, everything inside that. And about breakfast, it's very important in a day. Don't ever miss your breakfast. I have heard that IT professionals, they mostly prefer to have their brunch. Never do that, because breakfast means it's breaking the overnight fasting period. It replenishes, it's completely for brain. Whatever you take whatever you consume during breakfast, it completely goes on to the brain. It replenishes the supply of glucose to boost your energy levels. And you have to make sure that you have to include more of protein during your breakfast, because more calories are being burned during protein digestion rather than carbohydrate digestion, so that it keeps you fuller for a longer duration, so that you will eat only few calories for the rest of the time. Okay, everyone is very busy with their schedules, and they won't be having any time to cook their food. So most of them will be making cooking food for in weekends for one week itself, one complete week. They will be cooking food and will be storing in the refrigerator. Oh, don't do such things. Reheating cooked food or leftovers is very danger. It's very unhealthy. It's of no nutritive value, and it may cause food poisoning and will be toxin rich also. Okay, if you might have noticed that if you are keeping a cooked food outside in normal room temperature itself, for the next day you can notice that inside that there will be many bubbles coming inside that. For if you're keeping it for more than 2 or 3 days, then you can see that there will be many maggots or worms inside that. Same as the thing if you are taking inside also. Okay, and not only that, you should make sure that you have regular bowel movements. Means you have to pass on your motion every day, because the same is the thing. If you are having leftover, if your motion is not clear, that means that if you are having constipation for 1 day, then many more gas emission will be there. If you are having constipation for 2 or 3 days, then there is a chance of pinworms or worms in some manifestation inside your body. So it is a very bad thing, and you have to keep a regular bowel movements also. Okay, researchers says that preheating turns nitrates of which is present in celery, spinach, etc., into carcinogenic agents. Carcinogenic agents means cancer-causing agents. So don't ever reheat cooked food. And as per Ayurveda, it is said that you have to include much of turmeric, ginger, garlic, pepper, asafoetida, every etc., which is very which hampers all the toxins inside the vegetables or anything in our food, and promotes digestion also. 3 liters of water you have to consume it. It's very must, because you guys are in a centralized AC room throughout the day, and you won't feel the dehydration that your body is being feeling, because you won't feel to even have a sip of water also. But actually inside your body you are getting dehydrated, so hydrate your body with 3 liters of water every day. Okay, and exclude more of spices, masala, deep fries, sugar, excess food, etc. Regular bowels is a must thing. Okay, achar, everything it should be avoided. Packet food, tin food, everything should be avoided. It's not at all healthy. Once in a month or once in a while, it's okay. Don't use it regularly. And one more thing about the other thing is that hyperacidity. Okay, you might be craving in between. Sometimes we might feel some hike in our hunger also. During that time, we will be feeling so much hungry that we would have everything once. During that time, what happens inside your body is that there will be increased hydrochloric acid being released inside your stomach. That is the reason why you are having hike in your hunger. So during that time, your body is demanding to put in some food inside that. But if you are refusing to do that, if you are starving during that time, what happens is that in order to protect our stomach from this hydrochloric acid, there is a lining, a tile is there, tiled wall is there in order to help protect our stomach. Due to this increased hydrochloric acid release, this tiled wall gets cracked. When it happens, you will begin to feel the intensity of acid inside your stomach. This is known as hyperacidity. Okay, everything, all of this process takes more than 3 or 6 months. It is not at all because of one day's mistake. It takes more than. Okay. Just 1 minute. sleep is very important.
Arya, we are not able to hear. Are you there? Is there any technical issue over there? Okay, right now it is okay. Can we start the interactive session, Doctor?
Yeah, I'm ready for an interactive session. Anybody can ask anything.
Okay, I will
Within
ask
my
one
limited
question.
knowledge. Yeah.
Somebody while registering has asked about the acne problem, and the
Okay.
person was asking how to never have it. Like, is there any way never to have an acne?
Acne, it's mostly because of the sebaceous glands that are inside our skin. It gets swollen or gets infected. That is the reason why we are having acne. And moreover, that if we are having much of fat deposition, fat content is much in our body, then we will be there is chances of having that thing. And if you are having an acne in your face or anywhere, if you put on you keep on touching with that, the microbes from your fingers will enter into that. That is the reason why it is getting infected. So if in order to prevent it, you have to keep in mind that completely avoid fried items. No deep fry, no tin food, everything. Okay, and you have to give a deep. You have to use a deep cleansing action thing also. Maximum you go for a natural thing. Take some basin powder and mix it with some rice powder and apply it over there. It will act as a scrub. Okay, so that it will deeply cleanse your face skin also. After that, you can wash off your face in neem leaves plus salt, a pinch of salt inside, boil it and make it cool, and after that you can wash it off. Okay, that will be a very good thing. And in Ayurveda, it said that if your motion is not clear, there is a chances of acne also. Hello.
If there is any
Ah,
more question, if there is anyone having any question, you can ask in Malayalam also. ആർക്കെങ്കിലും ചോദിക്കണം എന്നുണ്ടെങ്കിൽ ആണ് ടൈപ്പ് ചെയ്യണം എന്നുള്ളവർക്ക് ടൈപ്പ് ചെയ്യാം. You can type your questions also. Meanwhile, I will ask you one more question. It's my personal doubt.
yeah,
You said like you have to, I mean, we can add a few like turmeric, ginger, garlic, etc. in our day-to-day life. I have a doubt whether it is good to have garlic in our daily diet.
just one slice. That's fine. If it's very hot potency, it's said that never ever take garlic in large quantities because it's very hot in potency. If we are having it inside, it will cause infertility in women and females, males also. It will make them sterile. That is the reason why it's not at all used in Ayurveda. In case of Ayurveda also, if it's used in some medicinal preparations also, we used to boil it in milk. Only after that we will be using it in medicines even. So it's very hot in potency. That is why we are just using a slice, just a slice, so that it will promote our digestion. That's all.
Okay, okay, thank you.
Okay. Anything else?
Yeah, hi.
Yeah.
I'm Ananya. So,
Hello,
like, I
Ananya.
have a doubt, like, how frequent should women go to gynecologist or do the thyroid test or PCOD and all testing?
Okay. Thyroid test, you have to do it for 3 months. If you are having thyroid, then you have to do it every 3 months, because a thyroid follicle, T3, T4, TSH, those have the lifespan of 3 months. Okay. So every 3 months, you have to keep on a test, routine test. And if you're not having any such issues, then yearly you have to do it after 35 years. If you're 35 enough, then you should do it yearly in order to rule out everything. Okay. PCOD also the same thing. If you are having PCOD, then yearly you have to take a USG ultrasound scan, and you have to make sure that your follicle is not at all increasing. It should gradually decrease it out. Okay. And PCOD, in order to make it out in blood levels, you can go for testosterone level also inside your body, serum insulin also. If you are taking both of these readings, then you can make sure that if you are having any PCODs or no.
Yeah,
Okay.
so more than 35 only it should be like yearly, right? So if it is
Yeah,
less
yeah.
than 35 means like how frequent we have to test for thyroid and all.
6 months yearly will do, no problem with that. If you are,
Yeah.
if as above said, if you are having any of those symptoms, then you have to definitely go for 3 months, within three
Okay,
months
okay.
And moreover, hereditary is also a problem. If your mother or any aunt or anybody is having, either from your mother's side or father's side, if anybody is having such issues, then you have to go for it. 6 months will be okay, no problem with that.
Yeah, okay. And also to visit the gynec, like how frequent we have to.
1 year is okay.
Yeah.
Okay,
Thank
the
you.
main
Yeah.
precipitating thing is that if you are having any irregular periods, that is the first and the most thing, either irregular periods or any weight gain without, even if you are not taking that much food also, but you are having air hunger, even if by having air also you are gaining or putting on weight, that means that there is a chance of PCOD also. So if you're having any symptoms like that, then you have to go and check it out. Okay, only that thing. Otherwise, you can take an yearly investigation. That will be fine.
Okay. Thank you, doctor.
Okay, fine. Anybody else? You are always welcome. Anyone can ask me anything. No issues. I would like to discuss a case also. A 10-year-old girl was presented in my clinic with the complaints of PCOS, and her mother took her to me. And I was shocked to know that she was being supplemented with metformin. Don't ever do such injustice to children, because they are just small. If she has started with metformin, then she has to take it lifelong. So don't do such things. If you're having a disease, just first step you have to do is that just give your body a chance to make it out. If it's not getting it, well, then you have to opt for medicine, but don't do such things. Even if it's hormonal treatment also, for a small gain you are doing a very big mistake. So don't do such things. Think before you make a step. Okay. Anything else? You're free to ask. Come on, ask me.
I have
മലയാളത്തിലെല്ലാം കുഴപ്പമില്ല, ചോദിച്ചോ. I'm
I have
just
request with you
same
if
as you.
um for this blood circulation thing, like there are some people, or even most of us are having this issue, like we feel sluggish or lethargic in some days, uh, mainly because of this periods and all. Is there anything we can do to recover that?
3 liters of water every day. Have lots of 10 raisins, black with seed raisins every day, so that you can restore your HB level. Okay, then the sesame seeds that I have said, it also restores this blood level also. Dates, 2 dates per day you have to take it. Pomegranate also, it also improves your blood level. During menstruation, that much blood loss will be that much blood loss will be there in your body. So in order to make it balanced, you have to take in iron supplements. Means iron supplements means I meant natural thing. Okay, don't make medicine as your food. Make your food as your medicine. No supplements can be no food can be replaced with supplements. Naturally, you have to take food itself. Make food as your medicine. Okay, nowadays people are very busy with taking tablets. Okay, no time at all to have their food also. So keep in your mind, have timely food as well as this thing also. Anything else?
Hi, doctor.
Yeah.
I'm Devika.
Yeah, Devika. Yeah, Devika.
Okay. So, is there any medicine for gastritis in Ayurveda?
Yeah, there are very wonderful medicines for gastritis, but it takes about 3 to 6 months, provided you have to be in a strict regimen also, because most of them gets fed up with all these modern medicines. Because you might have noticed that whenever a doctor prescribes an antibiotic, there will be a gastroprotective medicine also. Panadol, Randac, omeprazole, everything. So stomach. But am I audible?
Yes.
Okay. So for that you have to take in. If you take pomegranate after using, we are all use the seeds inside that. The outermost layer you shouldn't throw it out. You just make it dry, and you have to dry it nicely, and after that you have to grind it in your mixing. And take that powder every day with 1 teaspoon of mixed with 1 teaspoon of honey for 21 days in empty stomach. That will make subside this gastritis to certain limit. After that you can take medicines also. There are many medicines available in the market for in Ayurveda. If you come to my clinic, then I can provide you much more medicines also. Okay, otherwise you can just make a call, so that somewhat I need a detailed history for that. Okay.
Okay, doctor. Thank you.
Okay.
Are there any more questions? Okay, you were about to say something, doctor. You can say.
Yeah, my contact number, you can get it in my slide. There was one contact number, or else you can, I will leave it for Shruti. She will share it. Okay.
Okay, doctor. Okay.
Okay.
If anyone is having an interest in contacting, you can personally message me, that I will share her contact number. No problem.
And most of you IT professionals, you all are having desk-bound job. So your lower pedals, means lower limb, is having lack of exercise also. If you notice, water from height can go towards the floor because of the gravitational force. But in order to pump this blood from lower section to our towards our heart, it needs lot of pressure. So most of this desk bound job have most of them are presented with complaints of varicosity. So make sure that if you are sitting and working for half an hour, for 5 minutes you have to just walk around and come. Otherwise you will have in future, there is a chance to develop varicose veins also. So you have to keep in mind all those things. Okay.
Thank you so much. If there are no more questions, can we move on to vote of thanks? Any more questions, anyone? Okay. So I welcome Meghna for the vote of thanks.
Thank you, Shruti. I'm entrusted with the duty to deliver the vote of thanks. I, on behalf of IEEE Young Professionals Kerala section and the entire organizing team, extend a very hearty vote of thanks to our speaker of the day, Dr. Arya Ramesan, for taking this enlightening session on Ayurveda and women. It was a very informative session, and I appreciate all your efforts you have put into this session. And despite of your busy schedule, thank you again, Dr. Arya. I also
Thank you.
thank you. I also thank our coordinating team for conducting this event very smoothly. And last but not the least, all our participants who joined the event and made this a successful one. I hope to receive the same or even more support for our future coming events. Thank you all.
Thank you, Meghna.
Thank you.
Thank you for joining, guys.
Thank you. So let's wind up over here.